everybody, it's Dr. Dunn. I'm a surgeon that specializes in treatments of the esophagus and stomach in the San Francisco Bay Area. And today we're going to be talking about Barrett's esophagus. We're going to talk about what it is, how common it is, the risks from changing from Barrett's into cancer, how to watch Barrett's to make sure it doesn't get any worse, and some ways of treating the Barrett's when necessary. So first of all, what is Barrett's esophagus? Well, Barrett's esophagus is when the normal cells of your lower esophagus change their shape. Normally, the cells in your esophagus have a flat sheet-like appearance called squamous cells. If the cells are damaged, they change to become more of a shape like the cells of your stomach, like long columns. And you can measure that under a microscope, and you can see that change, and that's called Barrett's esophagus. So how common is Barrett's? Well, in the general population, the prevalence is between 0.5 and 2% of the population. So that means that at any given time, that number of people have Barrett's. However, for patients with acid reflux or GERD, the prevalence is a lot higher, 5 to 15%.
Over time, the constant damage to the esophagus from acid reflux leads to Barrett's.
Now the big question, how often does Barrett's esophagus progress to cancer? The good news is that the risk is quite low. The average chance per year is 0.3% if you have Barrett's that it changes into cancer. So only about 3 in 1,000 people. While this may seem small, it's important to recognize how serious esophageal cancer is. So most patients who have esophageal cancer, they don't present until late in the diagnosis, meaning that we're not aware of the cancer until it's far along. And the overall survival of esophageal cancer is quite poor. So it's best to catch it before it becomes cancer. And this is why physicians recommend screening with multiple endoscopies in order to make sure that your Barrett's doesn't progress into higher risk pre-cancer.
Next, let's talk about how Barrett's surveillance is done.
So what would happen is you go to sleep, you get anesthesia, and then a GI doctor or surgeon looks inside your esophagus with a camera attached to a flexible tube called an endoscope. And then if they see anything concerning, they take biopsies. And those little pieces of tissue are taken to the pathologist who looks under the microscope and sees whether these cells are precancerous or not. So how often should we do surveillance for Barrett's? Not all Barrett's esophagus is created equal. The cells under the microscope may look more disordered, and as they go from normal shape to change to be stomach-like, that's from normal to Barrett's, then you can also have more disordered looking, which is low-grade dysplasia, and then high-grade dysplasia, which is immediately before cancer. For normal Barrett's without dysplasia, it's recommended to get a surveillance endoscopy every 3 to 5 years. If we see low-grade dysplasia, surveillance should be more frequent, every 6 to 12 months. For every high-grade dysplasia patient, you should have screening every 3 months, or you should have an intervention to treat the high-grade dysplasia so that it goes away. So what are some of the procedures used to treat Barrett's? The most commonly done one in the United States is something called radiofrequency ablation. It is 90% successful in removing the Barrett's and is usually done in 2 or more treatments. The different treatment sessions would be 8 weeks apart. The procedure kills the Barrett's by heating them up with high-frequency radio waves. So we typically perform radiofrequency ablation for Barrett's when you have either low-grade dysplasia, high-grade dysplasia, or if you have a very long column of Barrett's and we're not sure whether some of that is going to be precancerous, then we would do ablation for that. So during the Barrett's radiofrequency ablation, you go to sleep like normal. The physician passes the flexible camera like normal, but then a flat tip electrode is pushed up against the wall of the esophagus, and then high doses of radio waves are delivered to that area. And this literally destroys the abnormal tissue. And then we gently remove that tissue. And we do 2 rounds of applying energy to all the areas of Barrett's of the esophagus. And then you wake up and we conclude the procedure. Follow-up endoscopy at 8 weeks is done to confirm that all the Barrett's was removed and do additional treatment if more treatment is necessary. The procedure is really well tolerated. Most patients have no symptoms other than mild discomfort. So then the other question is, does the Barrett's ever come back after ablation? And unfortunately, the answer is yes. The risk of getting Barrett's again is about 10% for every year that you still have acid reflux. Acid blocking medications like proton pump inhibitors have not been shown in the literature to effectively stop Barrett's from coming back or for preventing esophageal cancer. But if you're really interested in not having Barrett's esophagus again, anti-reflux surgery can help to prevent it from coming back. And in some cases, it has been shown to make small areas of Barrett's go away, basically allowing the esophagus to heal and return to normal without radiofrequency ablation. But that's on a case-by-case basis. So to tie it all together, Barrett's esophagus is when acid damages the lower part of your esophagus and the cells change their shape from being more like esophagus cells to being more like stomach cells. Over time, the cells can become more precancerous in nature. And this is why we recommend that patients with Barrett's esophagus have routine screenings to make sure that their Barrett's isn't getting worse. If the Barrett's becomes precancerous, then we can treat that with radiofrequency ablation, and anti-reflux surgery can be used to prevent the Barrett's from coming back. Thank you for watching. If you found this video to be helpful, please like and subscribe. And for more surgery education videos, please tune in to www.norcalsurge.com.